Hello everyone, this is Mehak Jain and I'm a dentist trained both in India and US and I'm so very fortunate for it. Looking back, I feel dental students back home have a lot of clinical experience and their dental training is focused around it, but not so much on little things but which are very important for rendering safe dental treatment like setting up a room, breaking down a room, sterilization and things like that. So I want to make some videos for you guys if this is something that you're interested in. If that's so, then stay put. This is Straight Talk with Dr. M. So first things first, we'll start with a good wash and we'll wash with soap and water. We'll wash for 20 seconds, go over each and every fingertips, don't leave the thumbs out, and then we'll wash them and use paper towel to dry them up. Now this is very important, you guys, before stepping into room at any point of time, whether it be you, your dental assistant, hygienist or front desk, whoever it is, they need to first wash their hands and then come to the op. Now after cleaning your hands with soap and water, you put the gown on and you open the lid for the cavity wipes and then you put on clean gloves. Now what I like to do, I take two cavity wipes out at the same time and I'll tell you why. So the first wipe is to go over the areas and it takes the bioburden out. Now we start our first wipe down and we go over all the areas which may have been in contact with our previous patient. You saw earlier that I took out all the wipes that I need at the same time from the box because I do not want to reach the box again with my soiled gloves. Cavicide are choice of disinfectant wipes because they are virucidal, bactericidal, and tuberculocidal. You also want to purge your water lines continuously for 2 minutes so that you get your water lines all cleared up, like so. Now I'm going back and wiping down all the tubes and all the attachments in the unit as part of my first wipe down. I actually ended up using 2 cavity wipes for my first wipe down. As recommended by manufacturer, the surfaces should remain wet for 1 minute for the cavity wipes to work. Now, after you wipe once in all the areas, you want to go with a second wipe and go over each and every area again. Now that truly disinfects it. Your surfaces are now disinfected and you remove your gloves and trash them. In our office, I found out that I should make some pre-made trays that are basic setups that also helps the assistant to make the room very quickly. So let me show you how we do that. Now I wear second pair of clean gloves and this is my basic tray with all the barriers and everything that I will need for a basic setup in one place. Now I start with setting up my disposable air water syringe and the barrier that will go over it. We use the sensor covers as barriers over our suction tip and little attachments like that, like saliva ejectors, suction tips and things like that. And when you want to use the suction tips and the air water syringe, just pull the barriers down and it just right snaps through it. This way your gloves are touching the plastic barriers and not the cords and the metal part itself while you're working, and this just adds second layer of protection. Okay, so let's continue with our barriers. I order medium size headrest covers because they're multi-purpose. I can use them over my headrest. I can also use them over my X-ray units, my microscope, and if you have a front delivery system, you can use them over your trays. I also use the sticky tapes as barriers. They perfectly attach to the light handles, the switches, the armrest covers for the patient chair, also for the operator chair. and I also put them on the back side of the operator chip. As intraoral camera is part of our basic setup, so we will have a barrier for that too. Now let's attach the bib to the back of the headrest so that it's right there when the patient comes, and we can just use it from there. Now this is all that I'm left on my tray with: patient goggles, mouth mirror, explorer probe, a piece of gauze, and intraoral camera is already set up. This is our basic setup. And that was it, guys. Hope you liked it. If you got any value out of this video, please hit that subscribe button and that like button. I'll really appreciate it. Thank you, and see you next time.